Hi, my name is Dr. Wellens, and I'm here to talk to you about a very exciting topic of bone infections. So please don't think if you're not a diabetic, you're immune to it. It is not true. Even though I have to admit, most of my osteomyelitis, which is the same name as a bone infection, is seen in my diabetic patients or patients who have severe peripheral arterial disease. Just because you're 18 does not mean that you cannot have a bone infection. So let me tell you, in my 25 years, I've seen probably 24 of cases of young athletic patients who had no previous medical history, who had a simple condition as an ingrown toenail that they didn't treat, they didn't take care of it. And guess what? Nail starts from the nail plate that attaches to the matrix, which is right on the bone of the middle or distal phalanx. And what it means is that you can get a bone infection if you don't properly treat an ingrown toenail. So what does it mean? It means that if you have an ingrown toenail, you need to go and see a specialist, you need to have it fixed, you need to have a culture, you need to have it properly diagnosed so it doesn't spread. But if you're a diabetic and you're in doubt that you can avoid seeing a podiatrist and you think you can treat your infection without major problems or consequences, you're wrong. So I can tell you is so many of my diabetics come in and they're like, oh, I've had this open sore on my foot for 3 months, and my primary care doctor gave me an antibiotic and I forgot to fill it, and now I have this thing sticking out and I don't know what to do with it. So this is bone infection 101. So please, whether you're an uncontrolled diabetic or you're somebody who thinks that you're too good to get bone infection, osteomyelitis, you need to properly diagnose and treat it. So please see a podiatrist. Please see somebody who knows what they're doing so you don't end up on intravenous antibiotics for 6 weeks. And yes, this is a treatment for osteomyelitis. Or even a partial amputation. So I can tell you is that intravenous antibiotics is something that is no fun. You will need to have a PICC line, which basically means you'll have to have a central line placed, and you will have to give yourself antibiotics through that PICC line for 6 weeks, and it still does not exempt you from a future amputation. In fact, you still have a 40% chance of an amputation, which basically means that something that can be easily fixed becomes a nightmare, and it's very costly because antibiotics through the vein is not a very cheap thing. So if you have a problem, please don't ignore it. Don't schedule an appointment 3 months from now. It is a medical emergency that needs to be addressed. And if you've seen all my previous videos in the past, you know how I am all into early diagnosis and early treatment. So please seek medical care.